me. There we go. Okay. So, let me get to that. I just want to see. Okay, so Sarah, will you look at my screen? Am I presenting? Yes. Okay. It doesn't show up anymore. I don't know why. Okay, so we got through the statistics and did we do this right here where we talked about
Yeah.
okay, so we were
It's
on like,
at the end of picture 9 with the
oh,
statistics.
oh,
We
okay,
didn't do
perfect.
those, and then after that, there's nothing.
Okay, thank you. Give me 1 second. My dog is scratching at the door. 1 second. Okay. Ugh. All right. So we were right here is what I'm assuming. Sarah, does that look right?
Yeah, I think it was the next slide after this though, because I think we
Okay.
did picture 9.
Okay.
We just hadn't done the statistics underneath it.
Okay. All right. Let me get organized here. Oh, jeez.
Sorry, I just thought I would throw that in there too.
Oh my God, I forgot about that. Oh,
Yeah.
Jesus. Great.
Yeah,
Okay.
give you something else to think about, right?
God.
Or stress about or whatever.
Ah, good. Okay. All right. All right. So here we go. So, they also have like this little sleeping sack that's really cute that you can put your baby in. It's kind of like swaddling in a way, but it's kind of a sack that they can be in, comfortable for them. Okay, so back to sleep and tummy to play. Um, it's like a campaign that they want, to remind parents that the baby needs to sleep on its back and that the baby does also need tummy time. Um, tummy to play prevents a flat head and builds their stomach muscles, which will help them to sit up later. So that's really important. Um, why do you guys think some parents don't want to put their babies on their tummies? What do you think some of their reasonings might be? Anybody want to talk to that? Why wouldn't a mom or a caregiver put the baby on its tummy during play? Anybody want to answer that one? There's no right or wrong. I'm just asking a simple, what do you think? Why a mom, why if I had a baby, why might I not want to put it on his tummy? Any ideas?
Because they can't breathe.
Okay, they might think, they might be confused about sleep and play. Maybe they're worried about putting the baby on its tummy, thinking that maybe, it will stop breathing. But remember that tummy time is really important to build those muscles and, to kind of give that baby a little independence. But some mommies, they may not want to put their baby down. They like cradling it and comforting it, and they do think of that. There are some babies known as bucket babies, and those are babies who spend the vast majority of their infancy in car seats, high chairs, bouncy seats, swings, walkers, and they do not receive the enough tummy time. So this can actually affect their development. So we need to make sure that, as caregivers, that we are giving our children all of the availability to develop the best that they can, and tummy time does provide for that. This is one statistic that I couldn't find an update on it, but it does show that the blue is the percent of back sleeping. So back in 1992, it was pretty low that parents were putting their babies on their backs, but as education took hold, they started going up, and we got about 75 percent of people that are putting their babies on their backs. And then if you look in 1988 at the SIDS rate, was pretty high, but as education took place, it started going down. So, that's definitely good news. Okay, so now we're on to the section where you're putting in the percentages, or I'm sorry, not percentages. Just the list of SID preventions. So that's where I'd like you to be on your notes as well, if you could be. I'm just trying to switch to make sure I am where you guys are on the notes. So just really quick here. Okay, so number 1, backs to sleep, remember. A firm mattress, nothing in the crib, no pillows or covers. Okay, 1 second. Okay. Keep your baby's crib in the parents' room until the infant is at least 6 months old. Studies clearly show that infants are safest when their beds are closer to their mothers. Number 4, do not place your baby to sleep in an adult bed. Typically, adult beds are not safe for babies, and do not fall asleep with your baby on a couch or in a chair. And for the crib's sake, pets are not good, bottles, stuffed animals, pillows, it should be clear of all that, even bumper pads, remember? So just make it a clean environment as far as like debris that could be in there that could cause a possible potential hazard. Number 5, do not overclothe the infant while they're sleeping. Just use enough clothes to keep the baby warm without having to use covers. Keep the room at a temperature that is comfortable for you, and then overheating an infant may increase the risk of SIDS. Number 6, avoid exposing the infant to tobacco smoke. Don't have your infant in the same house or car with someone who is smoking. The greater the exposure to tobacco smoke, the greater the risk of SIDS. Number 7, breastfed babies whenever possible. Breast milk decreases the occurrence of respiratory and gastrointestinal infection, and studies show that breastfeeding babies have a lower SIDS rate from formula-fed babies. Avoid exposing the infant to people with respiratory infections. Avoid crowds. Carefully clean anything that comes in contact with the baby. Have people wash their hands before holding or playing with your baby. SIDS often occurs in association with relatively minor respiratory and gastrointestinal infections, like when they vomit or have diarrhea or have mild cold symptoms. Offer your baby a pacifier. Some studies have shown a lower rate of SIDS among babies who use pacifiers. If your baby has had periods of not breathing, going limp, or turning blue, always tell your pediatrician at once. Call 911. If your baby stops breathing or gags excessively after spitting up, discuss that with your pediatrician. The other one, you can't really see that well. I don't know if I guess just listen. Thoroughly discuss each of the above points with all caregivers. So like a babysitter, a parent that looks after the child. If you take your baby to daycare or leave them with a sitter, provide copies of lists of this list that we're going over right now and the important details behind it, and make sure they follow your recommendations. Okay, so What I'd like you guys to do is to create a flyer. It could be like, you could either do this on a Google Doc, you could do this in Google Slides, or if you know how to make a pamphlet. Some people are really techie and they know how to make a pamphlet, like a trifold, bifold. But what I want you to put on there are risk factors. So you're going to pick 5 out of the list that we had, and there were 12. So you pick 5, and the ones that you feel are the most important, that, like, let's say if you had a pamphlet in your house for your babysitter, these are the 5 things you would want in there. Make note of the back to sleep, tummy to play, and then give me some statistics. You can use ones from the notes, or you can kind of go on Google and see if you can find something statistically about SIDS. And I would like it to be, you can do this. I mean, if you don't want to do it on the computer, you could always do it on a piece of paper and then just take a picture of it and upload it to me. So if you're going to hand draw things or just make it colorful, whether you do that with the computer or you use, you can do it on paper, it's totally up to you. But I really don't want any dead babies, so try to take a more positive approach behind it. So I'm going to give us some time to work on that. So you can do that. And then
dang it. I don't even know how to do that.
you know how to do a Google slide?
A slide, but why
Yeah.
is that a slide? I don't even have a partner.
You don't need a partner. Just what you do is you go to Google Slides and do like, you could do one slide, Tanner, with 5 things off that list, and you're just going to use your notes, those notes that we just went over. So just use that to do a couple slides on the
You said
5
one
things.
slide.
Well, I was talking about the 5 factors. And then you can do one slide that just says back to sleep, tummy to play, and then give me a couple statistics. And you're just going to use your notes.
Partner. I need help.
Okay, well, I can put you with Miss Gray then when I release for work time, okay? And she can kind of help assist you with that, okay?
I'll help Tanner.
Okay, so I need you to go off mic though, because I need to talk about this other thing I want you guys to work on.
Why do you give us so much? Why?
Okay, so moving on. If you look at your screen, and it looks like I'm still presenting, I also need you to go to this worksheet. And here's the notes on children in sleep, and I'd like you to read through children in sleep. And then what comes with that is another page here. And I just want you to kind of dissect what you read. And the only thing I could do is scan this. So just, go to a Google Doc and just write your answers on there. But these are the questions that I want you to answer using your resource. And that resource is right here, okay? So I'm gonna put Miss Gray with Tanner, and then if you guys have any other questions for me, you can ask me. Trisha, do you wanna be grouped in with Miss Gray, or are you okay?
I'm okay.
Okay, I thought maybe. All right, so let me set that up, Mrs. Gray, and then you guys can get started on the work.
Okay.
Okay. And then you guys that are still in the meet, just kind of hang on 1 second so I can disperse the people that need to be where they need to be. And then you guys can ask me questions. Okay, so
I'm gonna be just a minute.
Okay.
Before I get in there, okay?
Okay.
Tanner, I will be there, okay? Just hang tight, all right, bud?
All right, so I'm gonna go ahead and push out. So you're gonna go in that room right now. Maybe. Okay, so do you guys have any questions for me? I gave you some stuff to work on, but remember you have an extra day that the virtual or that the in-person kids don't have. So you could be working on this today and also Thursday. And then Friday, there will be some other stuff that we're gonna do. And then Miss Gray just reminded me that next Friday we have a half day also. And I forgot about that. So I'm assuming they're going to run it again, just like have all your classes. They're going to be shortened. And then we'll just have the test. And then when we're done with the test, you'll be out of there. Okay, so here's what I need. I need someone to tell me what they heard me say and what I want you to work on today. Can somebody recap just really quick? Gia? Monica, Callie, Sarah, what is it I need you to work on? I thought something was a little awry when you weren't responding. Okay, hold on. Okay. Okay. So yeah, you're gonna do the brochure, but again, you can just do it on a Google Doc if you want. You could do it on a Google slide, and I can bring that back up if you want. The SIDS picture that talks about that you need to do 5 things off the list to try to keep your baby safe from SIDS. And then tummy to play, back to sleep, have that on your whatever you decide to do. And then have a couple statistics about SIDS on there. And you can use all of this from the notes, or you can, like I said, go and, do it, do some Google searching if you want. Right. And for the children to sleep, you're going to read that information and you're going to transfer it into a Google Doc, because I scanned that, so you can't really write on it unless you can figure out a way to write on it. And just do that in a Google Doc and upload it to where it says children in sleep. And then remember, I screwed up and didn't give you the notes. So there's a section of notes you'll need to, transfer over. But for the most part, I gave you guys most of the notes. It was just a couple words here and there that you need to fill in. So it shouldn't be that difficult to do that. So I'm going to give you the rest of class time to get all this in. I will, if I can, in Google Classroom where it has your SID notes, that's where I would upload the brochure. Okay, so I'm going to put /brochure in here. That's where you'll also upload the brochure. And trying to think if the assignment is at the end of the notes. I kind of don't think it was, but let me just double check. Okay, so it's not. So I am going to go in and I'm going to copy and paste the expectations in at the end of your notes so you guys have them. And that way it'll be a little easier for you. Okay. I don't know if it's gonna let me or not. Will it let me do it? No. Okay, won't let me do it. All right, well, then I'm just gonna put it in here. There we go. Okay, so if you are looking at my screen right now, I put the brochure expectations right there, and then you'll just upload your brochure with your notes. All right. Can I get yes, I understand, or something, so I can make sure we're all good? Okay, thank you. So I'll just put in the chat. So you're going to do the sleep notes with worksheet. And then you're gonna do the brochure. And then transfer, it's right there. Transfer the notes to your guided. Okay, so there we go. Let me just check out deadlines so I can adjust anything that I think is necessary. So this one, your brochure, I think it's pretty reasonable to say that that's due Friday. It's not really that hard. You know, if any of these deadlines are difficult, you just kind of reach out to me and I'll kind of understand. We'll have an understanding with the two of us. But I think all that's reasonable, and your guided notes aren't even due until after the test next Friday. So, you know, you have Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, and then they're due Friday. So I think that's pretty reasonable as well. So, any questions or anything for the good of the order that you guys have for me? Sarah, are you all set?
Yep.
Okay. Monica, are you all set?
Yes.
Sierra, are you all set?
Yeah.
Okay. Gia, just put okay in the chat if you're good. Trisha, do you understand what you need to do?
Yeah, but I have a question. I need the can you send me the newborn infant guided notes, because my computer's acting up and it says there is a error.
So you need the worksheet where you fill the notes in?
Yeah, because my computer's acting up.
Okay, I'll send them to you.
Thank you.
Yep. Kelly, are you okay?
Yeah.
Okay. So you guys can stick around with me if you have questions or concerns, or you can go and pop back in when you have questions. But remember the deadline, so don't just like walk away from your keyboard and be like, I'm not gonna do it, or I'll do it later, because it's due on the 12th. So I would suggest that you get it done whether you're here or not. But that's up to you. So if you're gonna bug out, then just tell me that in the chat. And if you're gonna stick around, I'll see your little bubble. Okay. All right, Trisha, I'm gonna go ahead and send those to you now.
Okay.
Okay, Tricia, they should be sent. Let me know if you don't get them.
Thank you.
You're welcome.